My name is Nadia Sajjad, and I am obstetrics and gynecology consultant working at Middlesex Hospital, which is part of Chelsea Westminster Hospital since 2007. Every single day is super fascinating in obstetrics, where they are becoming new parents. It's a very life-changing experience, and if we can make it very pleasant for them, I think that's the best. To date, I have delivered so many babies by various methods, supporting a normal birth, operative vaginal births, cesarean sections, and every time it is super fascinating to deliver that baby, hold that baby first time in your hands, even before their parents hold the baby, and then showing that child to their parents. It is just mind-blowing how nice it feels, and emotional as well. How many times I have cried showing the baby to the parents is unbelievable. There is so much misconception about walnuts, peanuts, pistachio, cashew in the community that people know, but it's got a very hot and warming effect to your body, and it might cause a miscarriage. I said, no, nothing is going to do that. Chicken biryani is a problem if you're eating a large portion of rice and not taking that salad. If you buy a plate of chicken biryani from a shop, even a takeaway, they give you a packet of salad. Be smart. Instead of having that portion, the whole plate yourself, replace the rice with a big portion of salad that they have given you.
Do you have any single top tip?
Top tip is for pre-diabetic people is active lifestyle, portion size of your food.
How would you go about challenging someone's ideations or their cultural views on food, or things they've been told by family members is right but might not necessarily be right for them? Okay, hi. So welcome everyone to today's HIOS video cast, and today we're joined with a special guest. So
thank you very much. Thank you for inviting me, first of all, Ben. So my name is Nadia Sajjad, and I am obstetrics and gynecology consultant working at Middlesex Hospital, which is part of Chelsea Westminster Hospital. And I have been in the organization since 2007. Prior to that, I qualified in Pakistan and moved to United Kingdom in 2002. After getting married, surprisingly. My husband is settled in the UK, and after coming to this country for first couple of years, not much did apart from doing lots more English exams and further lab examination alongside started studying for my membership exam, completed my training in Merseyside, plus London predominantly, so northeast and north central region of London, and started as my consultant role in West London, where I live not very far from the hospital. So it's been a great thing that I can be at home and at work with a very easy travel.
Good.
That's brilliant. My special interest in my job is obstetrics, endocrine disorders in pregnancy. Medical education was another thing that was highlighted and was a key interest during my training. I also do a lot of minor gynecology procedure clinics and general minor surgical procedures as well for gynecology patients.
Yeah.
Thank you. So that's my basic day-to-day tasks.
Okay, that sounds really good. And I'm sure we've got lots of budding and aspiring surgeons out there. That's a very good background that you've given. And what kind of advice would you give to somebody who's looking to become a surgeon, maybe go into gynecology and obstetrics?
So I have always said to the junior doctors, because I used to be one of the representatives for the RCOG in my training days, in terms of aspiring the junior doctors to take obstetrics and gynecology as a specialty. So prior to becoming a doctor, my thought was to work for human rights. And my parents said to me, well, there are various other ways of helping human beings rather than just being a human rights person, because the struggle and the challenges are going to be far more greater. So think sensible. So I decided to do obstetrics and gynecology after completing medicine. For the new aspiring doctors, I would simply say that obs and gynae is, some people would describe it as a love or hate business. I absolutely adored it, and every single day is super fascinating. And it's a very happy side of our clinical work, We see very young couples in obstetrics and gynecology, predominantly in obstetrics, where they are becoming new parents. It's a very life-changing experience. And if we can make it very pleasant for them, I think that's the best thing. And to date, I have delivered so many babies by various methods, supporting a normal birth, operative vaginal births, cesarean sections, and every time it is super fascinating to deliver that baby, hold that baby first time in your hands, even before their parents hold the baby.
It's a privilege.
It's an extreme privilege. And then showing that child to their parents, it is just mind-blowing how nice it feels, and emotional as well. How many times I have cried showing the baby to the parents is unbelievable, considering I have a 15.5-year-old son as well. So that is the obstetric part of it. And obstetrics is beauty. Most of the time, things are perfectly fine. There are days when it is extremely challenging, very difficult situations that we come across, like large blood loss, surgical complications. But managing those surgical complications, then your real person or your clinical skills that you have learned during the course of your training comes out, and you practice that and make sure that the woman recovers well and goes home with her family. So that is the obstetrics. Gynecology one is where, yes, we manage all age patients with all age, the women with all ages. Majority of the times, the woman I come across is between 35 to 55 or 60, sometimes more than 60 years old as well, where they have got menstrual problems, heavy menstrual bleeding. Sometimes they come with a perimenopausal phase of life, between 45 to 55, when they're transitioning and they don't know what is happening. And I'm sure very often you get this question, oh, you just do a blood test because I think I'm going to menopause.
In general practice, that happens very often.
Blood test does not help. So making them understand that blood test is not going to do anything. Sometimes they come in with very basic question, but I was told that this is what's going to happen to me. No. I mean, most recently, I was referred a woman in the clinic to come in and have a Mirena coil, where she wants to have a second pregnancy. And no one actually has had the discussion with her about
having a
implications of having the coil to your next pregnancy. So when I explained to her about the whole situation, she said, "Oh my God, no one told me that. Oh, I don't want anything. I think I can manage my periods because they are heavy, but not affecting my quality of life." So that kind of changed the whole conversation. And then some patients who are on hormone coils for menopause, so just kind of doing some adjustments for them, and some minor procedures, which is my favorite.
Okay.
And some gynae surgery.
Great. What kind of minor procedures?
Minor procedures. So essentially, the ones I do in the clinic is lots of coil insertions and coil removals. Sometimes patients will just come to me as like one-stop service, where there is a tag after the vaginal birth. There might be some tag or skin tag or some skin alignment, abscesses, cysts on the perineal area, which can be done under local anesthetic and save them the waiting list of theaters. Cervical polyps, small or large, depends on. Sometimes I get referred from the GPs for very difficult cervical smears. So I do that.
Okay, so very helpful to primary care as well.
Yes.
So you've discussed some highs and some lows of the job as well.
Yeah. Overall, if someone wants to pick up obs and gynae, I would say the way the specialty is evolving, some people have said in the past the quality of life is not that good, but I would contradict that. I would say I'm on call, but I do on calls, I do theaters, I do endocrine disorders, and yet I managed to get home at reasonable time, give some time to my family, and have a good balance.
Yeah, that's very good. On that note, what do you, as a surgeon, do in your free time? How do you keep yourself entertained?
How do I keep myself entertained is I love cooking. Surprisingly, I do obstetrics, endocrine disorders, and then I still love cooking. So I do a lot of cooking. I like to go out with my family, going for long trips. Me and my husband, we're both very passionate about long travels by car, by road. So that is my spare time. And otherwise, just some basic boring household. I don't watch TV.
Okay. That's interesting.
That's important.
Is that because of time or is that a choice?
No, I don't enjoy it. I think they don't teach us anything. It's just more monotony of the same news.
That's different to this video, of course, because you will learn lots here.
Yes, of course. It will be different to this video. So yeah, that is so other than that, sometimes you just read a book or something, but majority of the time I've got very limited time. And if I have limited time, I much rather go out of the house with my husband and my son, just to kind of completely change so that we are not focusing on, because if you're staying in the house, I will then focus on something house stuff. But if you're out of the house and we can sit down, maybe have a cup of tea, coffee or something and talk about just outdoors rather than indoors. I like gardening. That is another thing which I really like.
Very good. Very mindful as well.
Yes. Yep. That's one thing which I really enjoy. Currently is trying to sort out some grass is not growing quite well.
Yeah, the lawn is always an issue. I think it's time to plant some seeds and overseed the lawn.
Yes. So, well, we did lots of seedling works and trees work last year.
Yeah.
So I have put some cherry blossom outside, some apples, cherries, trees. Fig tree has been going really well. Fig tree is experiment in this country. I wouldn't think they would grow, but they're doing really well.
That's excellent.
Thank you.
Now, I'd like to move on a little bit and talk a bit about something we're very passionate about and something you mentioned, education and having students and teaching as well. So in your work, do you have students and how do you go about doing teaching?
So in my workplace, we get a medical student from Imperial College. All the consultants, we have timetabled sessions for the medical students to be taught. Okay. We have 8:30 to 9:30 morning session and 12:30 to 1:30 the afternoon session. I select my topics, which I'm going to teach them, and everyone else select their topics. We do the tutorial every day in their 6 to 8 weeks rotation. And then I participate in the clinical teaching, which is like when they come to the labor ward while I'm on call, or if they come to my clinic, theaters, or whatever, wherever I am clinically assigned and they come in that clinical area, then providing them the opportunity to take history from the patient, performing clinical examination with the patient consent, of course, and giving them an opportunity sometime to kind of speak to the woman as well, just so that they can get the confidence for their PACES exam. Yeah. I'm also an examiner for the PACES final year, 5th year medical students at Imperial as well.
Just for people that don't know, what exactly are PACES?
So this is an oral exam for the final year medical students when they are about to kind of complete all their clinical stuff.
So very serious exam.
So it's a very serious exam. And we are assessing them at the level of their first year as a junior doctor in the hospital, where they will be supervised, but yet have some independence to work, especially when it comes to basic life support and kind of checking the blood pressure, heart rate of the person and seeing that if there's a bleeding, how to stop the bleeding.
It's a very important skill.
Yeah.
Okay. So let's move on to the next part of our talk. So as we know, diabetes is a very important topic affecting many people in our country. And there's also diabetes prevention programs as well. So we're going to talk a little bit about pre-diabetes, which is before you develop diabetes, and how you can prevent actually developing diabetes. Mm-hmm. So in your experience, you also talked a bit about doing endocrine as well.
Yeah.
So should we start off with what exactly pre-diabetes is and how we diagnose it?
Yeah, so pre-diabetes essentially is a state where you're not fully diabetic, but because over the years, there's a lot, you have been taking food or lifestyle is such that your body is constantly producing extra amount of insulin from your pancreas, which is one of the small organ in our body which produce insulin hormone, to kind of burn that sugar. Okay. However, if we continuously take high volume of sugar, carbohydrates, that pancreas start to become tired and body become more resistant to burn that sugar. And that is the stage where it's evolving into, the pre-diabetes is evolving into a type 2 diabetes, which is more age-related. And some is diet-related. And diet-related is becoming more and more common in this country, especially age under the 40.
Okay. Well, so affecting
it is,
people at a very young age.
It is affecting the younger people and at very young age. In your GP practice, I'm sure you would be aware that some patients can present with polyuria, which means passing a lot more urine, polydipsia, and feeling very hungry all the time. And that are like some early signs of diabetes, pre-diabetes. And also you can perform a blood test, which is called the hemoglobin A1C. And I feel very, very, very strongly is that we should put the people who are in the pre-diabetic range of the hemoglobin A1C onto the diabetes prevention program.
Yeah.
So that we can reverse it before it becomes type 2 diabetes. For that, diet, education, exercise. However, and the biggest thing I feel is the cultural change and thought process, which need to be changed in the patient's mind.
So that's quite a sensitive topic, especially in our communities and on the outskirts of London as well, where there's a lot of different demographics and people from various different cultures. So how would you go about challenging someone's ideations or their cultural views on food or things they've been told by family members is right, but might not necessarily be right for them?
Yes. So I have to be honest, absolutely 110% correct, that challenging someone is very difficult, especially when they have born and brought up with that. And they would say, well, nothing ever happened before, nothing happened. And very often when you speak to someone and you ask them, anyone in your family who has got diabetes, and the answer comes is, oh yeah, my mom has it, but she's old, so that's why she got diabetes. She was probably pre-diabetic and it was evolving, and then became type 2 diabetes.
So some people think that diabetes is inevitable and they're going to get it and it's age-related. And that some people think that maybe you can't prevent it. Correct. And if it's going to happen, it's going to happen.
To address that, initially I used to get, in the beginning days, I used to simply say, well, fine, it's their problem. But then I realized that actually not, it is my problem. I need to educate these people and make them understand. And now my biggest tool is we have a very lovely dietitian in our hospital. So whenever we have patients diagnosed with diabetes coming into the pregnancy, we have full education session for them. Then we give them a telephone appointment as well with the dietitian. But when they come to me with 1 week of monitoring and their blood sugars are still very high, and they look at me and they just say, well, yeah, this is high. And I say, well, you know what we need to do. But I have already done everything. So then I say, well, or some, especially the ethnic background one. Yeah, but doctor, are you from India or are you from Pakistan? I said, that's irrelevant. You tell me, well, how can I help you? Oh, but Asian food is really bad. So then my polite lecture starts. And I always humbly apologize for my patients in the beginning. And then I say, look, I have learned about the cultures and what they eat over the last 13, 14 years by talking to people. So say, for example, we were talking about this earlier, that, chicken biryani is a very big problem. I agree. I love chicken biryani myself, but chicken biryani is a problem if you're eating a large portion of rice and not taking that salad. If you buy a plate of chicken biryani from a shop, even a takeaway, they give you a packet of salad, they give you a little bit of yogurt, and then they give you the rice. Be smart, instead of having that portion, the whole plate yourself, replace the rice with a big portion of salad that they have given you. So salad is generally lettuce, cucumbers, tomato.
Yeah.
And when you tell them, she says, oh yeah, I didn't think about that. And next 2 weeks later, when they come and they say, well, what have you changed? Oh yeah, I had only quarter of a chapati, whole meal chapati, and then I had some curry without potatoes inside, and I had some water instead of fizzy drink. So it's very small, subtle changes that I talk to them about. And one thing which I hope you guys enjoy, or I don't know, or may be able to relate it. There is a Gujarati chapati and there is a Punjab chapati. The Gujarati community, my child one is a lovely Gujarati lady. I absolutely love her.
Yeah.
And my son used to come home and say, "Mommy, I had 4 chapatis." And I'm just like, "Oh my God, you're such a young..."
How did you manage that? Yeah.
How did you manage that? So when I saw her chapati was like that big,
Okay.
very thin, small chapati.
Yes.
So a child
And
can
very
eat 4
tasty.
of them, but very nice. Now the Punjabi chapati, I know, is big.
Yes.
It's big.
Yep.
It's heavy.
Punjabi
It's chunky.
people don't do it in half. So
Yeah, they don't do it in half. So when I described that to the patient once, and she looked at me and she said, "Oh my God, yes, you're right. The chapati, if I make that chapati to half or a quarter, I would actually not have a high blood sugar." And I was like, correct. Then, so similarly, when you have to relate it every time. Yep. You say, fine, chai in tea, don't put any sugar in, put less milk inside. Some people will say, a Weetabix, I had Weetabix now. Half the planet eats Weetabix to manage diabetes, high fiber. In my observation, there is no scientific research behind it. My observation is whenever I see Southeast Asian background people eating the Weetabix, their blood sugar goes through the roof. I don't know why. So I tell them that, look, don't add too much milk into it. Maybe cut down the biscuit to half, or like have only 1 biscuit, eat more egg. And fascinatingly, nuts. There is so much misconception about walnuts, peanuts, pistachio, cashew in the community that people know, but it's got a very hot and warming effect to your body and it might cause you miscarriage. I said, no, nothing is going to do that. If you are worried about it, have small amount, like 4 or 5 almonds, but make sure you don't have any nut allergies. Yeah. And they are much more filling. They won't let you feel hungry. Fruits, there is a little bit of myth about that in the community. There are many fruits. So we were talking about that summer is coming and mangoes. Yeah. Mangoes are very high in sugar.
They've just been in season, haven't they?
No. If you really want a mango, you eat 1 slice of it and then go for a 20 minutes walk. Grapes, small portions. Raspberries, strawberries, and blueberries seems to have very less sugar. But that doesn't mean that one should eat the whole punnet. Yeah. Maybe 3 or 4.
So it's very important about quantities.
Yes, quantities. Eat it and then walk it off.
So we've had patients who have come to us and they've said, my diet's very healthy. All I have is fruits and I have lots of fruits. And you look at their HbA1c blood tests that you mentioned and they're through the roof and they're very high. So I think that's another topic of education.
I was literally reading about this few days ago that it is having a fruit. Which version of fruit are you having? Are you having dried fruit? Mango slices, you may have seen mango slices being sold as freeze-dried or dried. They have very high volume of concentrated sugar, less water. Similarly, dates. That's the same problem with dates. High concentrated sugar. Raisins, high concentrated sugar because they are now dried. The water content has gone.
Are there any fruits you would recommend?
I would say
for our patients?
Clementines are perfect, but not orange juices. 1 orange, bound sugar. Because if you eat 1 orange, you have got fiber, you have got nutrition, and you have got some natural sugar in a smaller portion, which your body will absorb and release and manage it much easily rather than having, I'm going to have a glass of orange juice.
Yes, people has a lot more oranges.
Which probably have 3 oranges, free sugar, no fiber. So every time, even in my family, I always tell my husband and my son, if you want to eat an apple, eat the whole apple with the skin. Yeah. Because that's fiber. And you are taking the fiber and the sugar, it will absorb and release slowly in your body rather than bulk free sugar going in.
So the speed that sugar releases is very important as well. And, and you can use that to your advantage. Now, unfortunately, we have run out of time today, but do you have any single top tip?
Top tip is for pre-diabetic people is active lifestyle. Portion size of your food, reduce the amount of rice, chapatis. If we just talk about Southeast Asian culture, there's lots of fruits and vegetables in our diet. Increase the intake of fruits. Intake of whole meal food.
Yes.
Mixed grain, chapati, if you really want to eat chapati.
Yep.
Whole and lentils.
Yeah.
Because they are complex protein and carbohydrates, and active and healthy. Eggs as well. And active.
And being active.
What we need in our community is more movement activity. Go out on a sunny day.
Yeah, excellent. Thank you very much. That was very useful and very helpful for our patients.